Hey y'all, we are back with another video, and now it is time to discuss Adult Health 2. So we went through one, that was last term. Now we're in term 3 of 5. I have Adult Health 2 and I have Women and Children's. But today we're going to be discussing Adult Health 2. So I have completed the clinical rotation. I have passed my final. I have done everything for that class. I'm just waiting for them to finish my concept map approval or whatever. But let's talk about it. Let's get into it. So we're going to start off with answering some questions. I always ask y'all before I make a video, what questions can I answer for the next video that I make. So we're going to start off with the questions first. The first question that I got, did you take the exam for the clinicals? I think you were talking about the OA. I did take the OA before I went to clinicals. That's not required, but I did take the OA prior to clinicals. Outside of that, there's no other exam for that class besides the practice assessments, OA, but no other exam that you would have to complete. Does the instructor give you feedback afterwards? Yes, you have to meet with the instructor. They have like a debrief to kind of talk about your experience, and that's kind of how you get your check off for clinicals. Sometimes they'll pop in and they'll look to see what you're doing or try to assign you to do something. I haven't personally experienced that yet, but it is possible. But they definitely give you feedback. But I mean, my preceptor, they know what I can do, but I didn't have like a physical paper that I needed them to sign off on. It was just being there, being present, completing my shift, and just showing that I'm not struggling with being able to do what I need to do at this point in the program. Next is different options they gave you, like days and times. Y'all, they're incorporating the option for you to be able to select days and times, but I really haven't had much of an option. For my next clinical rotation, Women and Children's, they gave me 2 different months. I actually had the option to select, not Women and Children's. For my next clinical rotation, Psych, which is way the end of this year, they actually gave me an option for once to be able to do 1 month over the other, but they'll just give you a different 3-week window and it'll be different months. So that'll be the difference with that. So the next question was, how far in advance did I get my clinical schedule? And I got my clinical schedule the same amount or the same time frame that I got it last time, which was 3 weeks prior to my actual shifts. They sent me an email telling me my exact dates 3 weeks prior. Someone asked, have I been at the same location more than once? And yes, I've only been at one hospital. I was told at the beginning of the program that they try to keep you within the same hospital that you start with. So as an example, not saying this is where I'm at, but if I started with Methodist, they'll either try to keep me at that same exact location, or they'll move me to another Methodist depending on the availability. But I have not moved from the hospital I initially started at. That has not changed at all. And it is because when you start clinicals with these hospitals, you will have to sign up for their portal and you would have to complete orientation. And if you change hospitals every single time, you'll be having to do that every time you have to do a rotation. So they try to keep you at the same hospital. That normally that hasn't changed for me at all, not even the location. But I think that my next clinical rotation, it will change. Of course, for psych and community, it won't be the same hospital because that's completely different. So you may have a change when it comes to that. But as of now, for Adult Health 1 and Adult Health 2, I have been at the same hospital. I'm still going to be at the same hospital for Women and Children's, but it just may be a different location. So do not know yet. Do you switch to different floors? No, I do not. The floor that I started with was the floor that I was assigned to. And honestly, y'all, I actually like that better because I was able to latch on to a preceptor that was really good. And if I changed floors, I would probably be rotating people every single time. So that I think changing floors kind of make it a little bit more complicated. So for me, I was on the same floor and I had the same preceptor majority of the time because he was there most of the days I was there. And when he wasn't, I had to be assigned to someone else. But yeah. The next question is, did I have any skill checkoffs for the clinical rotation? And I did not. I didn't have any skill checkoffs for the last clinical rotation, nor this one. The only time I really had skill checkoffs is when I was at lab. But outside of lab, I have not had any skill checkoffs. So the last question was asking about an exemption for vaccines. If I know anyone who personally has had it, and I do not, I wish I could answer that for you, but I don't. I haven't heard of anyone getting an exemption. I have heard people ask about it, but I personally haven't seen it. I have all my vaccines, so I'm not too familiar with that aspect of it. But of course, the enrollment counselor or your mentor may be able to give you a little bit more insight on how that process works or what that looks like. So that one, unfortunately, I cannot answer. So at this point in the program, you're able to do a lot more because you're checked off on a lot of things. Since I went to lab and I did blood transfusions in lab, I got checked off on that, did assessments. I did a lot of different things, or I had a lot of scenarios thrown at me. So this time when I'm going into adult health 2, then of course you can be a little bit more hands-on. So I was able to, experience most of the things that I did in lab. I was able to experience in person, and it was actually pretty cool. But not only that, like the preceptors, I feel like sometimes they kind of make or break your experience. And so far, by the grace of God, I have had amazing preceptors. Every time I go there, I always end up staying assigned to one person because they always magically have, for the most part, magically have the same schedule as me. So this time I was assigned to the same person as well, and he was amazing, and he allowed me to be very hands-on. He was there to guide me through everything if I needed it, but he was right there by my side, but he was allowing me to be hands-on and kind of, be extremely active to where I kind of felt like I was a nurse myself. So that, I would say, is the difference with this rotation compared to the last rotation. I was a little scared and timid, and the bulk of what I wanted to do was just give medications, but I did a lot of helping this time around. So what you should expect when you're going into clinicals this time around is going in and you're going to be in the same unit as you were for Adult Health 1. It is just considered med-surg or somewhat some other units that may be similar, but you won't be in anything else besides stuff that's somewhat like med-surg. So it may not be too different from your first clinical rotation, but just being an advocate for yourself, if you're not being able to get the hands-on time, that is a very big thing. The clinical instructors are there to help. Most of them are there to help. So if you ever run into an issue, then at that point, reach out to your clinical instructor. If it's a nurse that you have that's not allowing you to do nothing, if they're treating you like a tech, they're asking you to go get juice, and that's about it, and you're really not being able to be hands-on, please advocate for yourself. Because if you don't, then of course you'll run into the issue where you couldn't really get the hands-on experience, and you don't want that. But I will say, like, the experience this time around is not too different from Adult Health 1. It's just a confidence builder overall. I will say this time when I went in, I was confident because this wasn't my first time doing it. And then the nurse that I was paired with made it 10 times better. So this time around, I did get day shift, and day shift was 10 times better for me because night shift, I was like a walking zombie. I was trying my best to stay up and readjust my schedule, but day shift was 10 times better for me. I did have my shifts 3 days in a row. It was all back to back. That was hard. But it was all back to back. But I will say the difference between the day shift experience and my night shift experience is in the day shift, it was a steady flow. It was always something going on. It wasn't like these 4 hours in between where everyone is sleeping and you don't have anything to do. It was a consistent flow. It was a lot more family members. So you may have a scenario where you're in the room and your nerves are already a little shook up and the family members are watching you. Please prepare yourself for that. And let me tell you, y'all, in that case, confidence is key. They do not know how far you are into the program. Do not go in. Well, of course, you might be scared. If you are scared, put a poker face on, because the family members, y'all, when I tell you, they are looking. Some of them are really sweet, but they're definitely looking to see what you're doing to their loved ones, which is 1000% understandable. Also, please be mindful that during the day shift, this is a time where management is present. A lot of people are present. You're gonna run into a whole bunch of different admins in the hospital. Please, whether this is day or night, put your best foot forward, because you don't know what kind of opportunities can come your way just from being, just showing your work ethic. Some people may be like, oh, we're always looking for this and that. Please, y'all, make sure you put your best foot forward so you can secure that job before you even graduate. So at the end of the clinical rotation, you will have a debrief, like I said, with the clinical instructor, and they will ask you about your experience. With my last clinical instructor, we had a debrief every single day, and she was amazing. That last one was like, she was A1. But she met with us, asked us about our experience. If we had any issues, reached out to her. But this time around, we only did one debrief. Met a lot of different people that wasn't in lab with me. Sometimes they kind of combine the cohorts based on availability. But overall, this clinical experience was amazing for me. The last day was a little slow because my preceptor was not there. But as I said in the last video, if you find a preceptor that you kind of match really good with, please, if you can, ask them, hey, can I be paired with you for the remainder of this rotation? Now, I will say, in some cases, you will be assigned to a specific preceptor, and you won't be rotated. You won't be rotated with different people. You'll have one assigned person. But in my case, I was just advised to go to the charge nurse, and the charge nurse will give me someone to precept. So sometimes I can be a little private, and I gotta get out of that habit. I don't know what's wrong with me, but I posted about this early on Instagram, but I deleted it. I did secure a position as a nurse extern in a hospital down here in Texas. I don't want to disclose exactly which one it is, only because it's a job that I will be working at. And I mean, I just don't want to tell the whole world what I'm working at. But I did secure the position, and basically a nurse extern is a position where you work in the unit where you see yourself being a nurse in, and it kind of helps the transition from you being a nursing student to a nurse. It kind of makes that transition much smoother. One, you gain the foundation for being able to do the basic necessities for that unit. 2, you build a rapport with management. 3, you're able to build rapport with the team. And 4, when it comes close to graduation, everyone already knows you. You're not just a piece of paper they're looking at as a resume. You're not just an application they're reviewing. It's someone that they personally know. So building rapport is always essential when it comes to securing a job in a specialty. It is not easy to get into. Specialties are getting a little bit harder to secure a job in, and sometimes people are forced to start in med-surg, which I don't want to be in med-surg. God forbid. Hopefully I'm not, only because it's not. Med-surg is, I don't know, I want to be a NICU nurse. That's why. We're just gonna leave it at that. But nurse extern, if you're interested in a nurse extern position, it is a position where you get paid. Again, that's per diem. If you want to find a job as a nurse extern, just Google nurse extern or professional student nurse, and on Google it should pop up with all the positions available in your area. The pay is different depending on where you live. But I would highly suggest, even if you don't do nurse extern, again, when you're in the hospital, please make sure you try to build the rapport with management, because I'm starting to learn that to secure a job, sometimes our networking is what secures a job for you more than anything. So please, if you haven't, look into it. So I will give a little bit of an insight on my nurse externship, because I do start that soon. I'm still working a full-time job. That is throughout the week. And then I probably will pick up shifts on the weekend for my nurse externship. But please, y'all, if you want to see some content on that, please let me know. I probably will upload something about it. I just won't go as in depth because it's not WGU, but I will post on my Instagram. Of course, I can't. It's only so much I can post, but I will post on my Instagram. So please stay tuned for that because that is coming up shortly. But if I missed anything, please feel free to comment. Make sure you like. Make sure you subscribe. Make sure you like and make sure you subscribe, y'all, so I can keep making these videos. I know I was a little late with this one, but I promise you I won't do that again. If y'all have any questions, drop them in the comments and I will answer them to the best of my ability. Y'all, any classes that I did in the pre-nursing term, I will tell y'all it is really hard for me to remember those classes. So sometimes when y'all ask me if it was like critical thinking, I would probably have to refer to my old videos to give y'all an answer, because once I pass a class, it is on to the next one. My brain is like in, out, in, out. Not always, y'all. I don't want y'all to think I didn't learn anything, but in, out, in, out. Again, y'all, leave comments, like, subscribe, and I will be back with Women and Children's, which I do attend in August.